Thank you so much, ma'am, and thank you, BOS Scientific Committee and BOS leadership for providing me this opportunity. I'll be very quick as we are over the time. So, I'll start with what aspiration we have. When we go into the trade, we see a lot of fancy instruments, and the aspiration is to have all of them. Everybody thinks that they should have all the toys to play with, but we have to divide it into some must-have or essential equipments, should have or optional equipments, and then can have or desirable equipments. So the must-have for an OPD is an autoref, a tonometer, optometry setup, a chair unit, slit lamp with 3-step or 5-step with imaging, and indirect ophthalmoscope and all of the fundus lenses. So this basic setup will set you back by around 8 to 10 lakh rupees. And you have a OT setup that requires an autoclave, ultrasound biometer, a good quality microscope, a surgical recording system, a basic phacoemulsification system, which is right now very costly, and ND laser. So all these will set you back by around 20 to 25 lakh rupees. So what are the options and why we need to know about finance? Because you need capital around 30 lakhs to start your private practice. You need to have your tax planning done and you have to leverage your balance sheet. So that's why you need to know your finance. So a very famous example is Vasan Eye Care. This was an example given in India Today magazine where they told that Vasan has too little batter and they spread the dosa too much, so the dosa broke. But the opposite can also be true, where you have a dosa batter and you're not spreading and you are not having a dosa, it's an uttapam that you will have. So you have to have a right balance to stretch and you get a good crispy dosa. So you have to understand how much you want to leverage. And optimal leverage will give you a good profit margin. And over leverage, you earn more, but your profit margin decreases. And when you under leverage, when you don't use your capital and your debt in a very good way, you have a large profit margin, but you can see the amount of revenue that you generate is very less. So finding an optimal leverage is very important. And the options of funding include inheritance, internal accrual, borrowing from friends, families, relatives, interest-free loan, IOL bundling with premium, without premium, loans from national banks, and loan from NBFC. And why me? Because I have I have right now everything going for me. Inheritance from my father, internal accrual through residency and through the salary that I earned before joining him. Borrowing from family, nobody gave me, apart from my father. Interest-free loan or equally divided PDCs for a specular microscope that I have got. IOL bundling without premium for Callisto is going on. IOL bundling with premium is going for Quatra. Loans from not from nationalized bank but from NPFC for Claris and Cirrus. So internal accrual is the best method through all of these that I have figured out, is because when you are going to pay an EMI and you do an SIP for the same amount, you see from having to pay an EMI of 20,000 and do a SIP of 13,000, 7,000 per month saving, and you are getting more on the average. So that's the concept of reverse EMI. Even if you inflation adjust for inflation, you are going to save a lot of money if you are going for internal accrual rather than going for anything else. But we won't have that much amount, and we don't want to wait for so much. We have to wait for 10 years to get the internal accrual. In that scenario, what we can do is do a lump sum payment upfront. And some amount we can go for a deferred payment or post checks through 1 year. So this we can do for any instrument that is going to cost us below some. We have to see how much our cash flow is, and this option can be taken up to machines which are around 10 to 20% of our total cash flow in our hospital. More than 20% of our revenue, if the machine is costing, better to go for a loan and an EMI. This all is very calculated based on different machines, but it will require too much of time to go through. IOL bundling is to be done in the scenario where the machine is directly related to the procedure that you are doing. So if you are doing cataract, then it's better to bundle your microscope or your phacoemulsification system with that. If you are not, it should not be done for the machines that are not generating revenue directly for IOL. And considering with premium and without premium, always go without premium, because with premium, it's nothing. You are tied up with that company for paying for using the IOL also, and you are paying the entire amount yourself. So better to go for IOL bundling without premium than going for with premium. The amount will become less. And also, the IOL market price before negotiating. Get the best price for your equipment beforehand, before negotiating the deal. Try to diversify a strategy in high cost equipment, so you break it into lump sum, PDC, and bundling all three. Confirm whether the ownership will be transferred initially or at the end of the tenure, because if it is going to be at the end of the tenure, you are going to have a second hand machine with no depreciation benefit, and that implies on your tax. And negotiate, try to keep the volume calculation on annual basis at negotiation. So how to decide? Internal accrual is the best way. For equipment costing less than of your 20% of your annual profit, have a lump sum. From 20 to 50% of your annual profit, have it on PDC. Equipment costing 50% of your annual profits, lump sum with PDC. And more than 50% of your annual profit, get it financed. So that is how what my take is till now. Thank you so much.